Welcome back, everyone, to Have More Babies.
Great to be here.
So today, we're diving into something super important for anyone expecting a little one, finding the absolute best pediatrician for your baby. It's a big decision.
It really is. And this isn't just, a quick choice you make. This person, this doctor, could be part of your child's life for a long, long time.
Right, potentially right up until they're, what, 21?
Exactly. Pediatricians often see patients through adolescence and into young adulthood. So building that trust, that open communication from day one, it's just vital.
Couldn't agree more. And we're basing today's discussion on some great insights from Omega Pediatrics. They're a practice with locations in Roswell and Marietta, right here in Georgia.
That's right.
And our goal really is to give you some practical steps, some key things to think about to help you make this choice confidently.
So maybe the first question is, when should people even start this whole process? It feels like one more thing on the massive pre-baby checklist.
It does. But ideally, you want to start looking maybe around 3 months before your due date. Omega Pediatrics recommends that time frame.
Yeah, that makes sense. It gives you breathing room. You're not scrambling right before the baby arrives or, right after when things are hectic.
Exactly. You have time to actually do the research, maybe meet people.
And where do you start that research? What's step one?
Well, your own network is often the best place, isn't it? Talk to your family, your friends, especially those who already have kids.
Definitely. Getting those personal recommendations, hearing about their real experiences, that's invaluable.
And don't forget your obgyn. They usually know the local pediatricians and can often give you some trusted names.
Good point. And beyond personal referrals, there's always online reviews and ratings.
Right, but you have to take those with a grain of salt sometimes, don't you?
You do. Look for patterns, maybe. Don't just rely on one really amazing review or one terrible one. Try to get a balanced picture and verify things if you can.
Yeah, absolutely. Another great resource, especially if maybe you're new to an area, is the American Academy of Pediatrics, the AAP.
Oh, yeah, they have the Find a Pediatrician tool on their website.
Exactly. It helps you find board-certified docs nearby.
Yeah.
Really useful.
Mm-hmm. That board certification is key. We'll probably come back to that. But first, as you're looking, you might see pediatrician and family physician. What's the difference there?
Good question. So, a family physician, they care for people of all ages, like newborns, kids, adults, grandparents, the whole spectrum.
Right, whereas a pediatrician specializes specifically in babies, kids, and teenagers, usually up to age 21, like we said.
So they have that really focused training on childhood development, illnesses, vaccinations, all that stuff.
Exactly. Their whole practice is geared towards kids. Now, that doesn't mean a family doctor can't provide great care for kids. Many do. But a pediatrician's expertise is just, well, deeper in that specific area.
So it kind of depends on what feels right for your family, maybe your own experiences.
Pretty much. Omega Pediatrics points that out too. It's about finding the right fit for you.
Okay, and then there are the letters after the name MD and DO. Does that matter much?
That's another common question. So MD is Doctor of Medicine and DO is Doctor of Osteopathic Medicine. Both are fully licensed physicians. They can diagnose, treat, prescribe, everything.
So what's the difference then?
It's mainly in the training philosophy. DOs get extra training in the musculoskeletal system and often have a more holistic, sort of whole person approach historically. MDs typically follow a more traditional research-focused path.
Interesting. So not necessarily better or worse.
Not at all. The most important thing, really, whether they're an MD or a DO, is board certification in pediatrics.
Oh, okay. That's the key credential.
Yes. That means they've passed rigorous exams specifically in pediatric care. Omega Pediatrics really emphasizes checking for that board certification.
Got it. Okay, so you've done your research, you have a short list maybe, and
Right.
what next? Just pick one.
Well, ideally, you'd meet them first. Omega Pediatrics strongly recommends setting up like a quick meet and greet or interview. You can often do this virtually now, too.
Oh, that's a great idea, like a little getting to know your session.
Exactly.
Yeah.
See if you click. Get a feel for their personality, their communication style, see if the office environment feels right.
Makes total sense. Before you even get to that meeting, though, there are probably some practical things you can find out, right? Like from the office staff.
Absolutely. Logistics are important. Things like, what are their regular office hours? What about weekends or holidays? How do they handle urgent issues after hours?
Yeah, like is there a specific number to call? Who answers?
Mm-hmm. And do they offer telemedicine appointments? That's become huge. How do they handle communication, like email? Is it secure and IP compliant?
Super important. And of course, insurance. You got to know if they take your plan.
Crucial. And how does billing work? Do you pay up front? Do they bill you later? What about potential out-of-pocket costs, copays, deductibles?
And the clinic location itself, is it easy to get to? Parking, public transport access. You'll be going there a lot, especially in the first year.
You really will. So nailing down those practical details first can save you headaches later.
Okay, so you've got the practical stuff sorted, and now you're actually meeting the potential pediatrician. What should you be asking them specifically?
Right. This is where you dig a bit deeper. Ask about their background. Where did they go to medical school? Do their residency training?
You mentioned board certification. Can you ask about that directly?
Definitely. And you can even verify credentials through resources like the American Board of Medical Specialties directory, which Omega Pediatrics mentions.
Good to know. What else?
Hospital affiliations are key. Which hospitals do they admit patients to? And like we touched on earlier, does your insurance cover those hospitals?
Right, double checking that link. What about day-to-day questions? Sometimes you just need quick advice.
Yeah, ask if there's a nurse available to answer questions when the doctor's busy. Who actually answers the phone? Can they handle immediate concerns, or do you always have to wait for a call back?
That's a good one. And what if your main doctor isn't available? Is there another pediatrician in the practice you can see? How does that work?
Understanding the coverage arrangements is important. And really nail down that after-hours process. How are urgent things handled outside of normal clinic times?
What about getting in quickly when your kid suddenly gets sick? Do they have same-day appointments or walk-in options?
Yes, ask about their policy on short notice appointments for acute illnesses. And can they actually treat common things like strep throat or ear infections right there in the clinic?
Okay. And what if your child needs to see a specialist? How does the pediatrician handle collaboration with other healthcare professionals?
That's a great question, especially if you anticipate needing coordinated care. Also, how do they handle genuinely urgent calls? What's the protocol?
And maybe ask about their general philosophy, like how often do they recommend well-child checkups? What are their thoughts on parents seeking second opinions?
Absolutely. And don't be afraid to ask about their stance on things that matter to you. Omega Pediatrics suggests this too. Things like their views on breastfeeding support, circumcision, if that's relevant, use of antibiotics, maybe even alternative medicine approaches.
Right, you want to make sure you're generally on the same page, or at least that they respect your viewpoint on those kinds of issues.
Exactly. It's about finding that alignment and feeling comfortable with their overall approach.
So after you've had these meetings, maybe met one or two doctors, Omega Pediatrics suggests taking a moment to reflect.
Yeah, just pause and think. How did that visit feel? Did the doctor seem genuinely interested? Did they actually listen?
Were you and your partner, if applicable, treated kindly? By the doctor, by the staff? Did you feel respected?
Did they take the time to answer your questions thoroughly? Or did you feel rushed out the door?
Were you comfortable asking questions, even the ones that felt maybe a little silly?
And the big one, did you trust them? Like that gut feeling. Do you feel you could trust this person with your child's health?
That gut feeling is so important, isn't it?
It really is. If something feels off, even if you can't quite put your finger on why, it's okay to keep looking. Don't settle.
You need to feel confident, feel reassured by the person you choose.
Absolutely. And remember, you can always change pediatricians later if things aren't working out. It's not a decision set in stone forever.
That's comforting to know. So speaking of finding a good fit, Omega Pediatrics themselves, based on the info we saw, they really aim for a positive, fulfilling experience during checkups.
Yeah, they mentioned creating a multicultural environment, really welcoming diverse families, and even providing intercultural education for their staff, which sounds fantastic.
That really does. Treating patients like family, that's a nice approach.
And they also offer some practical perks, like those extended evening hours, staying open till 9 p.m. some nights. That's huge for working parents.
Oh, definitely. Trying to get off work for a 4 p.m. appointment can be tough.
Right. And they offer telemedicine services, too, which adds another layer of convenience for certain types of consultations.
So those are things that show they're trying to meet families where they are, which is great.
Definitely reflects an understanding of modern family needs.
Okay, so to wrap things up, choosing a pediatrician is a big step, but hopefully not an overwhelming one if you break it down.
Right. It's about finding that blend of qualifications, good communication, and just feeling comfortable and confident.
So take the time, do the research, ask the questions we talked about.
And really trust your instincts when you meet potential candidates.
And if you want more detailed information or want to explore the care options at Omega Pediatrics specifically, you should definitely check out their website.
Yes, please do. It's omegapediatrics.com. Lots of great resources there.
That's omegapediatrics.com. Definitely worth a visit. And hey, if you found this chat helpful today, please give this video a thumbs up.
Yeah, hit that like button. And subscribe to the channel so you don't miss our future discussions for expecting and new parents.
And please, share this video. If you know other expecting parents trying to figure this pediatrician thing out, send it their way.
It might just help them out. Thanks so much for tuning in to Have More Babies.
It was great chatting today. We'll see you all next time. Bye.
Bye, everyone.